So if patient got relief from Ayurveda medicine and then he goes to pharmacy and starts treating by himself, that is not good for Ayurveda. So what's your opinion?
See, in India, we have got so many medical colleges, so many allopathic doctors, so many pharmacy colleges, so many pharmacists, but still, without any qualification, any degrees, there are quacks practicing very commonly across the villages and the rural areas of India. This is a very quite common practice. And Ayurveda was a household medicine from age old times in India. So there is a tendency that in the rural areas, people are knowing about our Ayurvedic system of medicines in their own way. But they may not be knowing the textual references and how their combinations or Chavanaprasha, how it cannot be. And of course, whatever if they do it also, they are always bounded by the legal consequences. And if something goes wrong, then they'll be at risk. And anything, if you don't say it also, if you don't prescribe it also, if somebody has given, it's a natural tendency in India, what we have observed is a patient comes to us, we are given a cough syrup or a combination for cough. He got relieved. What will do? On the next occasion, somebody in the family or somebody in the next house got the same cough, then he gives, you just take this combination which is given to me and it has given me result, you just take it. Then definitely these type of things you cannot avoid it. This is not possible to avoid. So this is very common. Don't worry about that. But anybody, if you are practicing near to a qualified doctor or a Vaidya and is causing a trouble in that, then you are always legally entitled to give a complaint against that person, one who doesn't hold any qualifying degrees. So to prescribe the drugs, then legal actions can be initiated by the local authorities.
Yeah, and we sometimes Ayurveda doctors sometimes have to take into consideration that the patient is going to self-medicate, may go to self-medication with the prescribed medicines, and we have to have some kind of we have to give some kind of degree of freedom to the patient in our mind. Not saying that you go and take it by yourself, but we have to take that into consideration. And when we are prescribing something which is of a kind of a serious nature, maybe with maybe it contains basmas, or we are not intending a particular medicine to be given for a very long period of time, then we have to specifically say to the patient that this should not be continued, even if you do not. I mean, these are medicines which should be taken for A, B, C, D, E. These medicines are to be taken for 2 months, but this particular medicine should not be continued beyond 2 months. You have to stop it. So we have to take into consideration serious kind of medicines and limit and educate the patient regarding the seriousness of stopping it when it is required to stop.
So that is one point. The other thing is, if you don't want that your combination or a medicine what is prescribed for the patient number A should not be used to the other patient, then you straight away say while giving to the patient number A that this is a special combination which I am prescribing only for you for this condition, and don't give it to anybody else. That itself will make the things, it will be sealed. So it will be used by the fellow and it will not be prescribed to anybody. So if you are having any doubt that you may go for dispensing later on to other fellows and friends and nearby, you want to avoid that one, then you can go for it.